Hello, my name's Lauren. I'm a registered nurse. Went to University of Florida College of Nursing and graduated in 1996. So I've been around the block. We are going to talk about fall prevention today, tips how to prevent it. Okay, so when you are assessing fall prevention, I like to do two things. First, start with the patient and then assess their home. So first, I would start with a head-to-toe assessment, which would start with their eyes. Can they see well? Have they had their vision checked lately? What about how their hearing is, or inner ear infections, or anything that would throw their center of gravity off? Working your way down, focus on the heart. That is a big problem with blood pressure shifts. When people go from sitting to standing, they can have blood pressure drops dramatically that can get them dizzy. What kind of medications are they on? They could be on something that gets them very drowsy and dizzy, either for blood pressure, pain, or a lot of other meds that can cause those problems. So you want to really review their medication list. Working your way down further, how strong are their legs? Any problem with their knees, arthritis? Our muscles get weaker as we get older, so you want to do physical therapy if needed and check in with what's all happening down there. Even lower, your ankles and especially your feet. Diabetics, checking their feet for sores on a daily basis. And what kind of shoes are they wearing? Are they stable? A lot of older ladies like to continue to wear their high heels, which in the long run is not always so safe. So that's basically the head-to-toe assessment that you want to really look and hone in on. Then moving to the home, you want to walk around and really assess if there's any obstructions. So if there's a cord from their lamp that's hanging out, or a rug, throw rug that's not secure. Preferably, throw rugs are not really the safest thing to have when you get older because they are really big hazards. Or if you had any problems in the past of maybe gently bumping into a table or something like that. Maybe they need to be shifted just slightly so they won't cause a fall. How is the lighting in the house? Is there enough light to see, to get around and see those obstacles? Are there night lights, especially on your way to the bathroom at night? And then moving into the bathroom where a lot of falls happen, you want to make sure there's railings, bars that you can hold on to get up from the commode, rails in the shower, and shower seats. People get very dizzy, especially again with blood pressure or medications. The heat in the shower can get them dizzy and want to fall in the shower. People that are elderly have been really used to their whole life having things certain ways, and they don't want to change a lot of their setup in their homes. And removing things like throw rugs is a lot of times a hard choice, and especially if they've had it in their family for years or something like that. In bathrooms, that's not usually the case. Usually those things are newer products, and those throw rugs that you have in front of your sink or shower or even the toilet are hazards. They can really cause pretty significant falls if their feet get caught up in those. The ideal thing is to get rid of all of those and get a non-slip surface on the floor. There are paints that you can coat on the floors or certain tiles that are more rough that you won't slip. And in showers also, you definitely want to make sure there's a non-skid surface that's safely put down flat where they won't get caught up in that too. So you got to make sure the floors are safe. If you want to assess the whole bathroom, You want to look at the toilet, the commode, and see if it's a little lower in height. Some people have older homes that it is very difficult to lift themselves up from the commode. So placing a grab bar on one side or both sides if possible to help themselves up. That's a big help to people with weak legs, arthritis, and other issues in their lower extremities. Moving over to the shower, you want to make sure they have a rod, a grab bar that they can hold on to in case they start to feel off balance in the shower, and also a shower chair if they do indeed get dizzy. Okay, so safety tips on fall prevention. So a lot of women, especially elderly women, really were used to wearing high heels their whole lives, or shoes that really are not things that keep them balanced. Men, every once in a while, you'll get one that has a lot of resistance and don't want to go to the comfortable Brooks shoes, or the different kind of New Balance shoes that are very flat, don't tip them forward. So again, going back to ladies, there's resistance there, and if you're a family member suggesting these things and you get some resistance, just ease into it and try to remember that they're losing their independence, and it can get them pretty upset. So sometimes it takes a little time to get to where you want to be, but with gentle persuasion, hopefully you can get there. Okay, fall prevention in the bedroom. So a lot of people don't really think about the height of their bed. So if it's too low and your legs are weak, or if your knees, ankles, anything's weak in your lower extremities, and you're getting up, it's going to be harder for yourself to lift yourself up. If the bed is too high, you run the risk of kind of hopping out and stumbling forward. So you want probably about right to the bottom of your fingertips, your longest finger height. So when you stand up, and you can push yourself up with your hands, or you could get a side rail that slides underneath one part of the mattress to the box spring, which is pretty sturdy, and you can use that as a handle on one side and push with your hand on the other side so you don't stumble and fall forward. A lot of people, when they're walking in and out of their house, they don't think twice about their steps. But if you've had a fall, or if you are a fall risk, steps can be a very dangerous place to be. So you want to make sure that there's railings, or one railing, and if your vision is off a bit, it really helps to have those safety strips at the end of each step, so you can really visualize where your foot's going to go. Safety tips on fall prevention in the living room area. You really need to assess the area, the rugs, the floor, any dangling cords that feet can get tripped on, and also animals. So if you're one to maybe say, hey, I know my home, I can walk around with my eyes closed, don't do that. And really be alert, look around constantly, and think about each step and each move that you're taking. Animals can definitely be in the way out of nowhere. So if you can do anything to train them to really behave, that helps a lot. Removing those throw rugs that you've had for years. I know it's difficult, but they are really big safety hazards. And just kind of tuck all your electrical cords away so your foot doesn't get caught up in that. And any tables or things that can easily fall off of a table, you want to really make sure there's hardly any clutter in your home. I know that's difficult, but you can do it. So these are my tips on fall prevention in the home. And if you do have any of the medical problems, such as high blood pressure, low blood pressure, inner ear issues, vision problems, please consult your doctor and get all that checked out.